Good morning to all the respected teachers and dear students and all those attending the webinar. On this beautiful morning, I, Dr. Pradna Shinde, is pleased to welcome each and every one of you on 4th day of Brainstorming National Webinar Series conducted by Antarbharti Homoeopathic Medical College, Dabha, Nagpur. We want to express our heartfelt thanks to organizing team of Antarbharti Homoeopathic Medical College for organizing these series of webinars, which is getting huge response. Today, we are eager to hear webinar on the most common problem of people, that is hypothyroidism, and how to deal with it by homeopathy. So, Dr. Zehra ma'am will share her immense knowledge on dealing hypothyroidism efficaciously by homeopathic way. Before we get started, I want to introduce our beloved and respected teacher, Dr. Zehra ma'am. She is Associate Professor and HOD of Subject Pathology in Antarbharti Homoeopathic Medical College. She has done her MD in Repertory from SKH Medical College, Bid. She is honored in physiology. She is a consultant at Hux Homeopathy Specialty Clinic, Nagpur. She has given many national and international webinars, as well as she has given a webinar in the Homeopathy 360. Ma'am is specialized in skin diseases. I sincerely hope that everyone will enjoy this webinar. It's going to be very informative and
A very good morning to all of you. Myself, Dr. Zehra. I am an HOD Pathology, Antarbharti Homoeopathic Medical College, Dabha, Nagpur. Just now, Dr. Pradna Shinde has given my introduction, so there's no need of giving it again. All of you are well acquainted with my introduction. So today, I'm feeling myself fortunate to be before you because of our respected director, Dr. Bhau Sahib Zite, and our principal sir, Dr. Prashant Barbat sir. So first and foremost, I wish them a good day. I will be dealing with a very interesting topic, that is hypothyroidism and homeopathy, and how to deal efficaciously with hypothyroidism in homeopathic treatment. So be patient to listen my webinar. So my today's topic is dealing hypothyroidism efficaciously, the homeopathic way. All of you know that hypothyroidism is a very common disease nowadays, and it was common in menopausal women previously, but nowadays even young women are affected with this. The reason is the life has become more stressful. So it is very common in every age group of women nowadays. And we homeopaths, we have to deal with many cases of hypothyroidism because when they go in for other pathies, they will only be suppressed. Their treatment will be by suppression only. And so when they come to us, we give them similimum remedies and constitutional remedies. And according to that, they are fully, we can't say cured, but they get a good quality life and all the symptoms are reduced and they are happy with our treatment. So today we'll be dealing with the interesting topic, that is hypothyroidism. First and foremost, I salute to our Master Henneman. All of you salute to our Master Henneman who has given us a great science, that is miraculous homeopathy. We can treat many irreparable damaged diseases, and degenerated joints also can be restored with our miraculous remedies. We have good results in many other diseases like chronic diseases like arthritis, then hemorrhoids, piles, and skin diseases, then incurable diseases like cancer also. We can give relief to the patient. We can just give him a good quality life. We can give good quality life to cancer patients also. Role of our miraculous homeopathy, like appendicitis, we can reduce the inflammation without surgery in appendicitis. And in many diseases, we can give relief to the patient. So, a big salute again to our master Henneman for giving us this miraculous science. Now, my warm regards to our graceful director, Dr. Bhav Sahib Zite, who has given everything to us. We can say everything because today we are under his fatherly guidance, and we are nurtured, the Antarbharti family is nurtured under the guidance of Dr. Bhav Sahib Zite. I thank him a lot. My warm regards to our respected Principal Sir, Dr. Barbot Sir, for arranging so nice series, national series of webinar and helping us, not even not only students but even practitioners and teachers will be benefited by this webinars. Thank you, sir. So now we will be starting with the main curriculum, that is thyroid. What is a thyroid gland? A thyroid gland is a butterfly-shaped small gland which is situated just in the lower part of your neck, hugged to your trachea. And as it is like the shape of a butterfly, it is very delicate, just like a butterfly. How is a butterfly? Butterfly is very delicate. When a butterfly, you will hold the butterfly very tightly or slightly also, then what happens? It will die. Similar is the like doctrine of signature, which is a therapy, which is a theory in our homeopathy. Similarly, the thyroid is also like a butterfly. If the body is mentally and physically stressed too much, then that stress is taken in by the thyroid gland, and this thyroid gland stops the normal functioning. What is the role of thyroid gland? The role of thyroid gland is secreting the hormones, that is T3, T4. Two hormones will be secreted by the thyroid gland, which helps in the metabolism process of your body. Here you can see very beautifully the lady is sitting so much stressed up. Yeah. So I can cite an example of a newlywed lady, newlywed girl. When she comes to a new home from her parents' home, she has to adjust a lot in the new home. And what happens if sometimes she doesn't get a admirable atmosphere or things don't go according to her mind? Then what happens? She's totally mentally stressed up, and she's so much stressed up that physical symptoms also show up. And when together, this mental stress plus physical stress, it will be taken in by the thyroid gland, and thyroid gland will stop its normal functioning, and it will be disturbed, leading the lady to hypothyroidism. Because thyroid hormones are very necessary for all the normal activities. It maintains your body temperature, it maintains your bowels, all the normal functions of the body require thyroid hormones. But when it will be disturbed, so this is the etiology: mental stress plus physical stress that will lead to hypothyroidism. You know, there is a role of pituitary gland also in hypothyroidism. Hypothyroidism has a very good selfless gland. How it will help? When the pituitary sees that thyroid is disturbed, the pituitary will signal its hormone, that is TSH, thyroid stimulating hormone, and it will increase the supply to the thyroid gland, and it will help the thyroid gland to function properly by supplying the TSH. So we have to go in for investigations like T3, T4, TSH, that is thyroid profile when we diagnose, probably diagnose that the lady can be suffering from hypothyroidism. Yes, we have seen that mental stress plus physical stress has caused hypothyroidism. So what will be the picture when it will be totally fully blown? The patient will be myxedematous. The body will be swelled up. There will be puffiness of the face, puffiness of the whole body. And this is due to what? It is due to the salt water retention. It is due to the salt water retention. Due to salt water retention, the swelling increases. There is lots of edema seen on the lower extremities also, and especially on the medial side. Edema will be on the medial side of the lower extremity. So, what is this? I know one thing I want to tell, that ptosis also you can see. Eyes are so puffy that there will be ptosis, there will be drooping of the eyelids, and lots of symptoms we'll see further. So the body becomes myxedematous, means the patient is not depositing total fats. Some part will be fat, but majority part will be the salt water retention, which is caused due to the disturbance of the thyroid gland. So myxedema will be seen. Now main part. We can see here the face of the hypothyroid lady. The hairs are very sparse. All it is main reason for hair fall. Hypothyroidism. We see severe hair fall in the patient. Now you can see, just mark the eyebrows. Eyebrows are also very light, and especially laterally they are very light. You can see laterally they are very light because hair fall also occurs on the eyebrows. You can see puffiness of the face, which increases in the morning. Then there will be skin will be dry, coarse and rough. Then there will be periorbital swelling, and the patient, you can see from the face only that the patient is depressed, because in hypothyroid we have many mental symptoms like depression, anxiety, weeping disposition, that will be seen further. Here also you can see lots of signs and symptoms of hypothyroidism. Here also hair fall will be there, menstrual disturbances will be there, even kidneys will be disturbed, bowels will be disturbed, patient will be severely constipated, then patient will have hyperacidity, bloating, less appetite. Hypothyroidism patient appears fat, but the appetite is very less due to bloating, because constipation is prominent in hypothyroid patient. If they don't take any laxatives, it is very difficult for them to pass the motion. Now here you can see clearly, you can see the paddle edema. The paddle edema is more on the medial side. You can see two ball like, and the edema is non-pitting edema in thyroid especially. In other diseases, many times there is pitting edema, but in this there is non-pitting edema. Hard non-pitting edema will be seen on the anterior part of the extremities. And you can see the dry, coarse skin also. It is due to the swelling. It is due to the edema. Yes, now very important, interesting symptoms you can see here. First and all, that is depression. The patient will be always depressed. The patient doesn't know what is the reason behind depression, but the patient will be depressed, and they will show it off to the doctor. They will tell the doctor that, doctor, I always feel depressed. I have lost interest in my day-to-day life. I don't feel like doing my regular activities. And patient is also very dull and depressed, because due to the low levels of the thyroid hormone, there is dullness in the body, and the patient is swelled up, myxedema. So that also causes dullness in the body. So the patient is in severe depression. And yes, weeping disposition is very common in the ladies who land up with hypothyroidism in our OPDs. They say that without reason, we feel like weeping. So when you when you get this symptom, instantly you can tell them to investigate for thyroid profile. And in majority of the cases, unfortunately, we find that the TSH level is raised. So bit of work, the patient will feel tired and patient will feel like lying down always. The patient will lie down for a long without any reason, because what is the reason? The patient is not tired by the work, but the patient is tired due to the lack of thyroid hormones. Then there can also be concentration problems. The patient will not be able to concentrate. If suppose the patient is attached with some academic activities, the patient will mention that nowadays my concentration is very disturbed and I cannot concentrate on my job. So the concentration is disturbed and patient can't concentrate because there is restlessness, there is uneasiness in the body of the patient due to the low thyroid hormones. Then there will be decreased memory. We can say dementia also. The memory will be decreased. The patient will keep the specs on the head and he will search it everywhere. This is the case. And hypothyroidism can occur in all the in both the sexes, male and female. So we have seen some symptoms. Now muscle aches are very, you can say, very prominent in hypothyroid patient, because the patient can't use the Indian toilet. The patient complains that she can't sit in the Indian toilet. So the muscles have become stiff and the patient feels lots of cramps at night in the legs. This is the main symptom of thyroid patient, hypothyroid patient. The patient can't sit for meals if she had to sit on the floor. So there will be muscle aches and cramps. Then joint pains. Joint pains are most the what we can say prominent symptom of hypothyroid patient. All the joints will pain, small joints plus large joints. Especially small joints will pain, that is fingers and toes, because gout is also associated with thyroid. So the uric acid levels are also to be checked in a hypothyroid patient, and usually, unfortunately, we find the uric acid levels raised or increased. So varieties of joints, joint pains like knee joint, the features of hypothyroid disease. Then weakness. Weakness is most prominent. The patient will say that previously I was having a very good stamina, but nowadays my stamina has dropped down and I feel very, very weak. So there is what we can say most prominent sign we can conclude that weakness can be of hypothyroidism. Like in diabetes mellitus also, the patient complains of weakness. But in diabetes mellitus, if it is diagnosed and if proper treatment is taken, the weakness goes away. But in hypothyroid patient, though patient is on medications, the weakness can be continued. Then there are delayed tendon reflexes. When we will check by tapping, we will get the delayed tendon reflexes in the patient. So, especially I told previously also that there will be dry, scaly skin. This is a feature of thyroid gland. And in winters, it becomes more drier. 12 months, it will be dry, but in winters, the hypothyroid skin will become more dry. You will find cracks in the skin in winters. And nails are always brittle. They break up easily and they don't grow. This is also a sign of hypothyroidism. And yes, the major sign is hair loss. This is the most prominent sign. Hair loss, hair fall. The patient will complain that my hairs are falling, and if not properly diagnosed on time, the patient can become bald or patient can live with alopecia areata also. Vital organs will also be affected, like kidneys. Renal impairment will be seen. If the patient is constantly suffering from hypothyroid and if it is not diagnosed, what happens in some villages? We get patient that they are having symptoms since months or years, but they don't get proper treatment. And ultimately, what happens if hypothyroidism was chronic and the patient was not diagnosed? So that can also damage the kidneys of the patient. Here you can see the edema. The whole limbs are edematous, and there will be non-fitting hard edema on the extremities. From this also you can diagnose hypothyroid. Such edema can also be seen in varicose veins, but that will be pitting edema. In hypothyroid, it will be non-pitting edema. Yes, this is the main thing. Goiter, enlargement of the thyroid gland. So what you will see in the lady, the neck will be swollen and there will be a goiter, enlarged thyroid gland, which can be seen with the naked eyes. That goiter can be seen with the naked eyes. So whenever the hypothyroid patient will come to you, how you will check the patient clinically? You will tell the patient to see upwards and you will tell the patient to swallow the saliva. When the patient will swallow the saliva, if the gland is enlarged, you will see it directly going up and down. Likewise, we can do clinical diagnosis of goiter. And the patient has hoarse voice. This is also a prominent feature of thyroid disease. The patient will tell you कि मेरी आवाज पहले बहुत अच्छी थी और अभी दिन पर दिन आवाज बहुत hoarse हो गई है. So from that you can conclude. And also tongue is very swelled up. Tongue becomes very thick in hypothyroid patient. That is also one of the reason for hoarse voice. He is unable to do normal proper working of the tongue also. So there will be hoarseness of voice along with the thick tongue. Then bradycardia. Bradycardia is a special feature because the body's metabolism is low, so heart rate will also be low, and there will be cold extremities. The body's temperature will also be low due to the disturbed metabolism. So bradycardia is a common feature. If you will find the pulse rate low, and when you will check the pulse rate and the patient is cold to touch, then also you can diagnose probably that it can be hypothyroidism. Prominent symptom that can be seen, menstrual changes. There will be, you can see oligomenorrhea, you can see amenorrhea, you can see dysmenorrhea, and varieties of menstrual disturbances when the patient is hypothyroid. So we have discussed about the signs and symptoms, about the complications of thyroid, what harm it can cause, and how it is very important to diagnose it properly and treat it properly on time. So when a patient will approach a homeopath, the patient comes from after leaving all the pathies, and in spite of that they will say that हम दोनों दवाइयाँ continue कर सकते हैं क्या? So what we have to do, we have to start our medicines, our simillimum remedy, our constitutional remedies after a proper case taking, and after that we will tell the patient that you should not stop immediately which medicines you are taking since long. Since long, they are suffering since long period and they are on medications since long. And if you will stop these medications immediately, what will happen? The level of the hormones will spurt up. So what we have to do when we will put the patient on a homeopathic treatment, we will tell the patient to taper the doses of the medications going on slowly, and then we will stop it totally. This is the proper way to start homeopathic treatment for hypothyroidism. So we have many drugs like thyroidinum, tuberculinum, pulsatilla, rustox, sepia, calcarea carb. And one more thing I want to tell you, go in for constitutional medicine for hypothyroidism. It will work very better. It will be the best. It will be the best option. So now I want to discuss about a very good medicine, that is tuberculinum. You know, when a patient will approach us, we'll do all the investigations, required investigations, the thyroid profile and USG, etc., etc., which is required. Even the patient is anemic. Thyroid patients are usually anemic. Mostly we see in our practice, they are also anemic because of the disturbed metabolism, and we have seen that their appetite is, so that can also be a reason for anemia. So tuberculinum 1 m remedy, this is a wonderful remedy which has to be given a single dose. It has to be given stat single dose when we will start the treatment. So what it will do to the hypothyroid patient, you have to give this and you have to wait and watch, and you have to tell the patient to report after 3 4 days. You take the reporting, how what are the changes, what symptoms he feel relieved, and what are the, if some symptoms are aggravated, or if the urine urine passed is large, in large quantity in liters, you ask the patient about this. So you will get the report that the quantity of frequency of urine has increased a lot, and the body swelling after some days you will see pent up. So tuberculinum, how it works, it relieves the pent up water out of the body. It throws away the water out of the body. So you should start the treatment with a single dose of tuberculinum, and you have to wait and watch just. This is the most efficacious remedy, thyroidinum. How does it, this thyroidinum will act? It will come to your mind that by other pathies, the remedy is given and you have to give in the same pattern, a single dose only you have to give this, because it is to be taken in at a particular time. But we can give this remedy according to your curriculum. We can give it BD also, we can give TDS also. We have to check the TSH level. If the level is raised too much, you can give BD. If the level is slightly raised, you can give OD also. So this remedy is very good for myxedema. It will relieve the patient of the myxedema, that is swelling. We have, as we have seen in the tuberculinum also. So the patient will be relieved of the myxedema, plus the joint pains will be relieved. The patient will feel better. There will be no bloating in the abdomen. Constipation will be relieved. But you have to check the doses accordingly, and every 3 monthly you have to send the patient for the thyroid profile. Next remedy is the wonderful remedy, calcarea carb. How is the patient constitution of calcarea carb patient? The patient is fair, fatty, flabby, and patient has an inverted abdomen like a saucer. All the symptoms are pointing towards hypothyroidism. And the patient is having hair loss also. So calcarea carb is a very wonderful remedy, especially it will relieve the stiffness of the joints, stiffness, pain of the joints, and patient will be able to walk properly, because hypothyroid, what do the low functioning of the thyroid gland do? They will hold all your joints, they will hold all your muscles, and you will feel, the patient will feel that the joints are locked. So calcarea carb, when given properly according to logical doses, then it can give immense relief to the patient. Because in majority of the cases, I have also find relief in the patient by this wonderful remedy, that is calcarea carb. One more thing, you can identify the patient from the mentality also. Suppose all the symptoms are there, patient is fair, fatty, flabby, and you are diagnosing that the constitutional remedy is pointing towards calcarea carb. Just see 2-3 prominent mental symptoms. See whether the patient is very obstinate. The patient was, ask her, how was you in maths in your school days? If she'll say that my maths were very weak, then 100% you can give the constitutional remedy, calcarea carb. Next remedy is the wonderful female remedy, that is sepia. Sepia is a wonderful remedy that will control the disturbances, mental disturbances. The patient's irritability will be relieved very early. The patient's weeping disposition, the patient will find relief in the weeping disposition, and because it will be due to all the turmoil, due to the low levels of the thyroid gland, there will be lots of mental changes, mood changes seen in the patient. All this will be relieved by the wonderful remedy, that is sepia. Our next remedy is another wonderful remedy, Baraita carb. Baraita carb is a very good remedy for hypothyroidism with mental changes. And here, typical constitution can be seen. The patient will be dwarfish, patient will be short-heighted, and a little bit idiotic. You will find we find such constitutions. So the patient will be little idiotic. Then if you can see more prominent red line symptoms that will be pointing towards Baraita carb, you can directly go in for Baraita carb in case of hypothyroidism, and it will give relief to the patient. Next remedy is Phytoleca decandra mother tincture. This is also a very good remedy. You have to give it in mother tincture form, and you have to give in massive doses form. This remedy also works wonders in hypothyroidism, in which the patient will have specially the fat deposits on the tummy. There will be lots of fat deposited on the tummy, and other body will be thin. We can say lemon on a toothpick appearance. Lemon on a toothpick appearance. The legs will be thin, the hands will be thin, only the torso, especially the abdomen, will be very large. So in that case, we can give Phytoleca decandra mother tincture. So we have discussed lots of remedies, and there are more lots of remedies in homeopathy that can be given in for hypothyroidism according to the constitution. That calcarea fluor can also work well if joint pains are severe. Calcarea phos can also be given if there is osteoporosis along with hypothyroidism. Then if the patient is suffering from gout along with hypothyroidism, you can give benzoic acid also. You can give urtica urens mother tincture also to control the gout along with hypothyroidism. So we have very marvelous, wonderful remedies in homeopathy that can give relief to the patient of hypothyroidism. But you must know the tact, how to hold the patient, for hypothyroidism, because what happens if they are stressed while the treatment is going on? If they are stressed, again the symptoms will appear. So if you find that the patient is stressed up, the patient is depressed, or the patient is having some grief, then what happens intercurrently? We can also give ignitia. Ignitia can be given intercurrently. So there are many foods that has to be avoided in thyroid, and many foods which you must increase in your diet, especially the two, cauliflower and cabbage. These are very dangerous for the thyroid patient because of the content in that. It will increase the complaints of the patient. The bloating will be increased. Hyperacidity will be seen if the patient takes this food, which are not advisable. So you can avoid these foods to get complete cure. You can avoid the cold drinks, you can avoid the cold beverages, you can avoid the carbs, etc. And you must eat fresh salads, fruits, fish, etc. in a lot of quantity. So if proper medication will be given and proper diet and regime will be followed, the patient can be cured properly. So all this was about hypothyroidism and how to deal hypothyroidism efficaciously with homeopathy. I feel that it will be beneficial for the patients also if a doctor will give the proper diet chart also along with the medications. So this was my say on hypothyroidism in homeopathy, and I want to conclude my say by telling thanks to our director sir, thanks to our principal sir, and thanks to Dr. Akhilesh Khan sir, and thanks to all the viewers who have patiently listened to my webinar. So I thank all, and I feel lucky to be an Antarbhartian. Thank you.
Thank you so much, Dr. Zehra ma'am. It was indeed a great presentation. It has sparked a true knowledge on the topic by Dr. Zehra ma'am. She has explained etiology of hypothyroidism very nicely, explained remedies and its mentals in very innovative ways. Now I request Dr. Nilima Bannore ma'am for vote of thanks.
Hello, good afternoon to all. It's my privilege to have been asked to propose a vote of thanks on this occasion. Let one first of all start by giving glory to the Almighty God as making today's occasion a resounding success. I, Dr. Nilima Bannore, on behalf of Antarbharti Homoeopathic Medical College and Hospital, Dabha, Nagpur, extend a very hearty vote of thanks to Dr. Zehra ma'am, Associate Professor and HOD of Pathology, for her wonderful speech and the thoughts and experiences she shared with us. I thank our respected director, Dr. Bhausaheb Jhite, as his stewardship, support, vision, and commitment. My heartfelt thanks to our respected principal sir, Dr. Prashant Barbat sir, has his valuable contribution, guidance, and encouragement in all the efforts. I owe special gratitude to respected Dr. Akhilesh Khan sir, who have worked hard to ensure that this occasion become a memorable success. Last but not the least, I thank all my colleagues, friends, and beloved students for your cooperation in making this event a grand success once again. I thank you all as your attention. Thank you.